Understanding bladder anatomy, a simple guide. The urinary bladder is a hollow, muscular organ located in the lower abdomen. It serves as a temporary reservoir for urine produced by the kidneys. This organ stores urine until it is ready to be expelled from the body during urination. Anatomically, the bladder is situated in the pelvic cavity. In males, it lies between the pubic bone and the rectum. In females, it rests in front of the vagina and uterus. The bladder is connected to other structures by ligaments that help keep it in place. The bladder has four main parts. The apex is the top portion attached to the median umbilical ligament. The fundus, or base, is the bottom part that contains the trigone, a triangular area important for urine flow. The body is the main section that collects and holds urine. The neck is the narrow area continuous with the urethra, through which urine exits the bladder. The bladder's walls are made up of several layers, including a specialized lining called transitional epithelium. This lining allows the bladder to stretch as it fills with urine without damage. The muscular layer, known as the detrusor muscle, contracts to push urine out during urination. The bladder's capacity typically ranges from about 400 to 600 milliliters but can stretch to hold up to 1,000 milliliters. As the bladder fills, sensory nerves send signals to the central nervous system. This coordination helps relax sphincter muscles while contracting the detrusor muscle to control urine releases. Blood supply to the bladder primarily comes from the superior and inferior vesical arteries, which are branches of the internal iliac arteries. Venous blood drains through the vesical venous plexus into the internal iliac vein. Lymphatic drainage mainly occurs via the external iliac lymph nodes. Nerve supply involves both sympathetic and parasympathetic fibers, which regulate bladder filling and emptying. The internal and external urethral sphincters control urine flow. The internal sphincter also prevents backward flow of semen into the bladder in males. Understanding this anatomy is crucial for bladder health and bladder cancer awareness. The bladder's lining, known as the urothelium, is where most bladder cancers originate. The trigone area and bladder neck are important for maintaining continence and preventing infections. Any disruption in the bladder's structure or function, whether from infection, inflammation, or cancer, can affect urinary control and health. To maintain bladder health, proper hydration is essential. This helps flush out toxins and bacteria. It is also important to avoid irritants that may damage the bladder lining. Early detection of symptoms such as blood in urine or changes in urination patterns is crucial, as these may indicate bladder cancer or other conditions. In summary, the bladder is a stretchy, muscular organ designed to store urine safely and releases it under controlled conditions. Its complex anatomy supports these functions and plays a key role in urinary health and disease prevention. Always consult healthcare professionals for personalized advice regarding bladder health.